So in terms of midlife, there are actually 5 risk factors, and these are hearing loss, traumatic brain injury, hypertension or high blood pressure, alcohol misuse, and obesity. And so, according to the WHO, or the World Health Organization, the threshold for hearing loss is about 25 decibels. And so, research suggests that our risk for developing dementia increases for every 10 decibel increase in hearing loss. So, multiple studies have found that hearing loss is typically only associated with worsening conditions, however, in people who don't use hearing aids. In other words, who don't treat their hearing loss. And so researchers note that hearing aid use is actually the largest factor that can protect you from cognitive decline. So the researchers sort of think about the way that hearing loss might be impacting cognitive decline is really due to the reduced cognitive stimulation. So for any of you on the call who have experienced hearing loss, and I know as I get older, I'm certainly starting to experience some hearing loss as well, is that it's harder to hear in a group setting. It's harder when you're out and there's lots of activity and lots of background noise. It's harder to focus on the person in front of you in the conversation that you're having. So one study found that folks with hearing loss were actually more socially isolated, that they had less support and faced a higher risk of anxiety and depression compared to those without hearing loss. So again, sort of that reduced cognitive stimulation. But that using hearing aids actually reduced the effects of social isolation, lack of support, and anxiety, but they didn't kind of correct for depression. And then one of the studies that I think is really quite interesting is that this is a recent study, came out in the last couple of months. The researchers from UCLA studied metabolic changes in the brain that are believed to be related to mild cognitive impairment or very early stage Alzheimer's disease. And they looked at the brains of people living with mild cognitive impairment. And they found that participants who had untreated hearing loss had significant metabolic decline in the frontal area of our brain. And that's the lobe of our brain that's really responsible for executive function. But that people who were using hearing aids did not show that same decline in their frontal lobe. And that the rate of decline was actually faster in the untreated hearing loss group than those using hearing aids. And so the researchers concluded that while hearing loss can speed up metabolic changes, using hearing aids can actually help slow that process. So for all of those of you on the call who have older adults in your lives who, have a love-hate relationship with their hearing aids, as I know some of my family members do, really do encourage them to wear them because it can make a big difference. And so the International Classification of Disease defines traumatic brain injury or a mild traumatic brain injury as concussion, and severe traumatic brain injury as skull fracture, as edema or brain swelling, brain injury, or a bleed. And so traumatic brain injuries are typically caused by car, motorbike, and bike injuries. But there's also occupational traumatic brain injury, and that can result, for example, from serving in the military. If you happen to be a boxer for a career, or you ride horses for a living, you're involved with firearms, or any kind of occupation that might involve a fall. And so a study of more than 30,000 older adults with concussion, so here we're talking mild traumatic brain injury, found the risk of dementia doubled over a 3-year period. And you may have heard talk of beta amyloid plaques and tau tangles, because those are certainly considered the hallmarks in our brains of Alzheimer's disease. And researchers have shown that severe traumatic brain injury is associated with some of that tau pathology in both mice and in humans. Now, what was interesting is that a Swedish study found and that study actually looked at about 3 million people. So again, a fair number of folks are over the age of 50, and they found that a single mild traumatic brain injury, so just a single concussion, increased the risk of dementia actually less than severe traumatic brain injury, which is what you might expect. But again, experiencing multiple traumatic brain injuries would then further increase the risk of dementia. So in terms of preventative measures, really you want to do all you can to avoid all types of head injury. And as someone who has suffered a concussion during a sporting injury, they're nasty and you do want to avoid them. So you want to steer clear of activities that are going to put your brain at risk of harm or protect your head when you engage in those activities. So always wear a seatbelt when you're in a car. Wear a helmet, whether you're riding a bike, a motorbike, a snowmobile, a scooter. I think scooter is a big one. The number of times I see folks riding a scooter and they don't have a helmet on. If you're riding an ATV, if you're playing a contact sport, riding a horse, skiing, snowboarding, I mean, the list goes on. When you're batting in baseball, doing everything you can to protect your brain. And then taking steps to reduce your chance of a fall in the home. So you want to exercise to improve your balance and your strength so that the risk of falls is less likely. Thinking about removing some of those small throw rugs that could be a tripping hazard, and using non-slip mats in the bath or the shower. So one of the other ones that has quite an impact on our dementia risk, one of the other factors, is hypertension or high blood pressure. And we know that persistent midlife high blood pressure, and so by that we're talking about a systolic pressure that is greater than or equal to about 130 millimeters of mercury. And so when you go to the doctor and they put the blood pressure cuff on your arm, that's the 130 is that top number that they give you. They'll give you two numbers, and the 130 is the top number. And that's associated with an increased risk of later life dementia. And that risk has been noted to increase further if that hypertension or high blood pressure persists from midlife into later life. And people who have really ideal cardiovascular health, so someone who might be a non-smoker, who's got a healthy body mass, healthy diet, healthy cholesterol level, regular physical activity, they've all been found to have a lower 10-year risk of all-cause dementia, vascular dementia, and Alzheimer's disease. But in individuals who have this persistently high systolic pressure over 130, from ages 45 to about 61, dementia risk has been found to increase even if they're free of these other cardiovascular risk factors. So relative to people who don't have high blood pressure. So in other words, if you only have high blood pressure and none of those other cardiovascular risk factors, you are still at greater risk for dementia than those who don't have high blood pressure but have cardiovascular disease. So it really is the high blood pressure that is a key part of this. And how does blood pressure actually impact our brain? Well, it's typically associated with more shrinking of the gray matter in our brain. And gray matter is where the information processing happens in our brain. And we also see reduced brain volume, and we see increased white matter lesions. And white matter is what provides the communication between the gray matter and then the gray matter and the rest of your body. So both white matter and gray matter have an important role to play in your brain. What is interesting is that a US study of, I think almost 10,000 older adults aged 50 and above found that actually lowering systolic pressure to below 120 millimeters of mercury significantly reduced the risk of mild cognitive impairment and also slowed the buildup of those white matter lesions. And so that's actually led researchers to conclude that successful blood pressure control with antihypertensive treatment improves outcomes as compared to uncontrolled hypertension. And so research looking at the long-term data of more than 30,000 adults actually showed that managing your high blood pressure with blood pressure medication reduced your risk of dementia to the same level as someone with normal blood pressure who wasn't on blood pressure medication. And so that's led researchers to really boldly say that antihypertensive treatment for high blood pressure is the only known effective preventive medication for dementia. So the underlying story there is if you have high blood pressure, you want to monitor it, talk to your doctor, and you want to look at ways that you might be able to lower that blood pressure. Research has actually shown a U-shaped association in which both high blood pressure and low blood pressure, so think of it of a U, were associated with a lower risk of dementia. So I think those findings really point to the need for further research to really understand how our blood pressure levels relate to dementia risk at different ages. Because sometimes that low blood pressure can occur the older we get. And remember that what's good for your heart is good for your brain, and really make an effort to monitor and manage your blood pressure. So now we talk about alcohol misuse, and I think really we know that the relationship between alcohol, between cognition and dementia, it's a pretty complex one. Alcohol is strongly associated with cultural patterns and other sociocultural and health-related factors, which can make it actually particularly challenging to kind of tease out those pieces and understand the evidence. So a French study of more than 31 million people found that alcohol use disorders, so this is defined as harmful use or dependence on alcohol, was associated with increased dementia risk for both men and for women. And this association was particularly clear when the onset of dementia was below the age of 65, so what we would call young onset. Now, drinking less than 21 units of alcohol per week may be associated with a lower risk of dementia. And so you say, well, what does 21 units of alcohol mean? Well, a typical glass of wine would be considered 2 units, and a pint of 5% alcohol. Beer or cider would be 3 units. So while a single shot of liquor would be 1 unit, that translates into drinking more than 1 beer a day or more than 10 glasses of wine a week. And there's certainly some conflicting evidence about the benefit of drinking in moderation. So one systematic review that had looked at I think about 45 different studies reported a reduced risk of dementia compared with folks who didn't drink. So light to moderate drinking, they had a reduced risk compared to those who didn't drink. But then a UK study that followed a group of about 10,000 individuals for almost 25 years found that both drinking more than 21 units and long-term abstinence were both associated with an increased risk. So that's a bit of a conflicting findings there. But we can tease that out a bit by saying typically when studies look at alcohol use and dementia risk, they're comparing drinkers with non-drinkers, but they don't divvy up that non-drinker category. So when you think about non-drinkers, you can think about people who have sort of been non-drinkers much of their life. And then you've also got non-drinkers who maybe have given up alcohol before the time period of their study, who may have had health reasons or health problems that have caused them to stop. So in fact, that might actually increase their risk over time compared to lifetime non-drinkers. And so we kind of need to be a bit careful about teasing out those two groups when we're looking at the research. And how does alcohol consumption influence dementia risk? Well, again, it's linked to the volume of the brain's white matter, which, as I said, helps transmit signals between the different brain regions. And then that can cause issues with how our brain actually functions. And alcohol can also shrink the parts of the brain that are involved in memory. And then the last midlife modifiable risk factor is obesity. And self-reported data from the 2022 Canadian Community Health Survey suggests that close to 1 in 3 Canadians was obese in 2022, compared with just over 1 in 5 in 2003. So this harkens back to what I mentioned at the start of today's presentation, which was really around, is that trend of a lower incident rate in younger cohorts, are we going to start to see that change as we see our rates of obesity increase? And so obesity was lowest among Canadians aged 18 to 34 and those 65 to 79, but it really peaks for those of us between the age of 50 and 64. And so Health Canada defines obesity as a progressive chronic disease that's accumulated by abnormal or characterized by the accumulation of fat, so excessive fat that then in turn can impair our health. And so it's estimated typically from something called the body mass index, or the BMI as it's more commonly known. And that's simply a function of someone's height and weight. But there are many issues with the use of BMI as an indicator of health. But for the purposes of today's talk, we're just simply going to, focus on the fact that increasing evidence supports the relationship between an increased BMI, particularly one above 30, and dementia. Whereas a BMI of between 25 and 30 was not associated with later life. And so if you're interested in sort of figuring out what your BMI is, it involves entering your age and your height and your weight, and you can quite easily do that in any of the online tools that pop up when you Google BMI. But multiple studies report that weight loss of more than 2 kilograms in people aged 50 plus who had that BMI of 25 or greater was actually associated with improved attention and memory over a 24 to 48 week period. What we don't know much about is the long-term effects of weight loss and dementia prevention. Now, how does weight loss reduce the risk of dementia? Well, again, it's suggested that it plays into a variety of metabolic factors and that it improves those metabolic factors.